Hey everyone, this is Ian back with another head and neck anatomy video. In this video, we will be discussing the foramina of the skull. You may remember from your anatomy class that a foramina is an opening that allows for the passage of nerves, arteries, and veins from one region of the body to another. Today we will discuss the foramina located in the different bones of the skull. So there are foramina located in the face and the skull base, but let's start with the foramina of the face. The bones of the face that contain foramina are the frontal bone, the maxilla, and the mandible, and each foramen contains a nerve, an artery, and a vein. First, let's start off with the supraorbital foramen, which is located in the frontal bone right above each orbit. And the contents of the supraorbital foramen include the supraorbital nerve from the cranial nerve V1 and its associated artery and vein. The infraorbital foramen is located in the maxilla right below the orbits, and the contents of the infraorbital foramen include the infraorbital nerve from cranial nerve V2 and its associated artery and vein. Lastly, the mental foramen is located in the mandible. The contents of the mental foramen include the mental nerve from cranial nerve V3 and its associated artery and vein. It's important to remember that the mental foramen contains the mental nerve because it is a high-yield topic for your exam. And you know I love high-yield topics more than I love the foramina of the face, but parting is such sweet sorrow, so now let's move on to discussing the foramina of the skull base. So let's switch to a superior view and start off with the ethmoid bone, which is located right here. So this lies anteriorly at the base of the skull. The ethmoid bone contains the cribriform plate, which has a bunch of tiny holes to allow the olfactory fibers from cranial nerve 1 to pass into the nasal cavity. Next we have the sphenoid bone, which lies posteriorly to the ethmoid and frontal bones and contains several foramina. The optic canal contains cranial nerve 2, the optic nerve. And the superior orbital fissure contains cranial nerves 3, 4, and 6, which are nerves associated with vision, and the ophthalmic branch of cranial nerve 5. Next, the foramen rotundum contains the maxillary branch of cranial nerve 5, and the foramen ovale contains the mandibular branch of cranial nerve 5, and the lesser petrosal nerve. Make sure to remember the foramen rotundum and the foramen ovale because they are both high-yield topics for the exam. Next, we have the foramen spinosum, which contains the middle meningeal artery, and we have the foramen lacerum, which contains the greater and deep petrosal nerves. Now we have our temporal bone, which lies in the middle of the base of the skull between the sphenoid bone and the occipital bone and its foramina. Note that we are now viewing the temporal bone from a superior view. The first thing to focus on is the internal auditory meatus, which contains nerves 7 and 8. When you hear the internal auditory meatus, you can very easily make the connection that cranial nerve 8 or vestibulocochlear nerve is involved. Next, we know that the jugular foramen contains cranial nerves 9, 10, and 11, which makes sense because the word jugular refers to the neck, and the 9, 10, and 11 are the cranial nerves associated with our neck region. Next, we're going to flip our skull around so we can look at the temporal bone from the inferior view. Here we can see that the carotid canal, which contains the internal carotid artery. In addition, we have the stylomastoid foramen, which contains the facial nerve. And lastly, we have the occipital bone, which lies posteriorly at the base of the skull. The foramen magnum communicates with the vertebral column and therefore contains the spinal cord and the spinal and vertebral arteries. A fun fact is that the foramen magnum literally translates to big hole in Latin, which reflects its appearance. And the hypoglossal canal contains cranial nerve 12, which is the hypoglossal nerve. So now let's move on to example question 1, where we have our trusted friend, Mr. Bones, as our guest star. So which nerve exits from the structure indicated in this image? The supraorbital nerve, the infraorbital nerve, the hypoglossal nerve, or the mental nerve? Now you can pause if you want to pause, but I'm going to move forward with the answer, which is D, the mental nerve. So the supraorbital nerve of cranial nerve V1 exits from the supraorbital foramen. The infraorbital nerve of cranial nerve V2 exits from the infraorbital foramen, and the mental nerve of cranial nerve V3 exits from the mental foramen. Now, this relation between nerves and foramen should be pretty straightforward. However, the one slight difference is that the hypoglossal nerve exits from the hypoglossal canal. And now that that's that, let's move on to example question 2. Which foramen does the mandibular nerve exit? The foramen spinosum, the foramen ovale, the foramen magnum, or the foramen lacerum? And just like always, I wait for no one, but I'm a video, so you can pause me. And the correct answer is the foramen ovale. So now I'm going to highlight the sphenoid bone, which is where the foramen ovale is and the mandibular nerve exits. So the middle meningeal artery exits from the foramen spinosum, the spinal and vertebral arteries exit from the foramen magnum, and the greater and deep petrosal nerves exit from the foramen lacerum. Now let's look at a summary of everything that we talked about today. Okay, so the first thing we discussed was the nerves, arteries, and veins associated with each foramina of the face. Next, we discussed that cranial nerve V1 passes through the superior orbital fissure, and that cranial nerve V2 passes through the foramen rotundum, and that cranial nerve V3 passes through the foramen ovale. Thank you so much.